Hello, my name is Martha. My partners for this presentation are Emily and Adria. Today we will be talking about diabetes type 2.
Date of discovery. The earliest known mention of diabetes symptoms date back to 1552 BC. An Egyptian physician named Hesi Ra documented frequent urination as a symptom of this unexplainable disease, which also caused extreme weight loss.
The term diabetes is a shortened version of the full name diabetes mellitus. Diabetes mellitus is derived from the Greek word diabetes, meaning siphon, to pass through, and the Latin word mellitus, meaning honey-eyed or sweet. This is because in diabetes, excess sugar is found in blood as well as the urine. Fun fact, it was known in the 17th century as a pissing evil. Harold Hemsworth finally distinguished between the two types of diabetes in 1936. He defined them as insulin-sensitive and insulin-insensitive. Today, these classifications are commonly referred to as type 1 and type 2 diabetes. About 20 years ago, type 2 diabetes wasn't observed to occur in children. In fact, it was once referred to as adult-onset diabetes, and type 1 diabetes was called juvenile diabetes. As more cases began appearing in children and teenagers in the past 2 decades due to poor eating habits, lack of exercise, and excess weight, adult-onset diabetes was renamed type 2 diabetes.
Diabetes is not just a matter of high blood sugar. It exacts a toll on the entire body. Damage to the blood vessels have grave and lasting second-order effects, which include vision loss, cardiovascular disease, kidney damage, and nerve damage. The combination of nerve damage and decreased ability to heal can lead to the loss of distal appendages.
Cause and mechanism of affliction. Type 2 diabetes is primarily the result of two interrelated problems. Cells in muscle, fat, and the liver become resistant to insulin. Because these cells don't interact in a normal way with insulin, they don't take in enough sugar. The pancreas is unable to produce enough insulin to manage blood sugar levels. Being overweight and inactive are key contributing factors. Slow healing, left untreated cuts and blisters can become serious infections, which may heal poorly. Severe damage might require toe, foot, or leg amputations. Nerve damage, neuropathy in limbs. High blood sugar over time can damage or destroy nerves, resulting in tingling, numbness, burning, pain, or eventual loss of feeling that usually begins at the tip of toes or fingers and gradually spreads upward. Eye damage. Diabetes increases the risk of serious eye disease such as cataracts and glaucoma and may damage the blood vessels of the retina, potentially leading to blindness.
Diagnostic criteria. The American Diabetes Association recommends routine screenings with diagnostic tests for type 2 diabetes in all adults age 45 or older and in the following groups. If you're overweight and or obese and are younger than 45, you should get checked. Women who have had gestational diabetes should get checked. People who have been diagnosed with prediabetes, and also children who are overweight or obese and who have a family history of type 2 diabetes or other risk factors. Type 2 diabetes is usually diagnosed using the glycated hemoglobin A1C test. This blood test indicates your average blood levels for the past 2 to 3 months. Available tests for diabetes. There's a couple tests available for diabetes. One of them is the A1C test. The A1C test is a blood test that provides information about your average levels of blood glucose. There is fasting blood sugar test. This measures your blood sugar after an overnight fast, so no eating. There's a glucose tolerance test. This measures your blood sugar before and after you drink a liquid that contains glucose. Normally, the glucose tolerance test is given when you're pregnant. Another one is random blood sugar test. This measures your blood sugar at the time you're tested, and you can take this test at any time and don't need to fast.
Diabetes is a widespread issue in America today. As of 2019, approximately 35 million Americans are plagued by type 2 diabetes. That number increases by over 1.4 million annually. About 12% of the Lone Star State's population is afflicted, with an additional 600,000 suspected undiagnosed cases. The prevalence of type 2 diabetes is strongly associated with race and ethnicity. It is believed that about 15% of Native Americans have been diagnosed. Non-Hispanic blacks are the second most affected at approximately 12% of the population, and approximately 11% of Hispanics have been diagnosed, 9.5% of Asian Americans, and 7.4% of Caucasians.
Risk/environmental factors. Factors and risks that may increase your risk of type 2 diabetes include family history. The risk of type 2 diabetes increases if your parent or siblings has type 2 diabetes. Areas of darkened skin, usually in the armpit and neck. This condition often indicates insulin resistance. Inactivity. The less active you are, the greater your risk. Physical activity helps control your weight, uses up glucose as energy, and makes your cells more sensitive to insulin. Race and ethnicity. Although it's unclear why, people of certain races and ethnicities, including Black, Hispanic, Native American, Asian people, and Pacific Islanders, are more likely to develop type 2 diabetes than white people are. New research studies the association between environmental qualities in over 3,000 United States counties and find intriguing differences between rural and urban areas. The results of this analysis showed that overall, a poorer environmental quality had links with a higher prevalence of type 2 diabetes. The research linked inferior air quality, food, and residential noise, and built socio-demographic factors with a high risk of diabetes in rural areas. However, in urban areas, the researchers associated only air and socio-demographic factors with diabetes risk. Available treatments. The treatment for type 2 diabetes include non-insulin medications and insulin. Typically, for a diabetic patient that has a more severe case of diabetes, would have to be placed on insulin that have to be administered 2 to 3 times a day, depending on the patient's blood sugar and how well they maintain it. A patient that has diabetes, the go-to treatment plan for that would be non-insulin medications. That's typically what they like to see in patients, non-insulin medications. And some of those include metformin, glidozones, insulin-releasing pills, starch blockers, incretin-based therapies, amylin analogs.
The available types of insulin are nearly as varied as the delivery methods. Insulin is grouped according to how long it works in the body. Rapid or short-acting insulin helps reduce blood glucose levels at mealtimes, and intermediate or long-acting insulin helps with managing the body's general needs. There are several ways for a diabetic to administer insulin. The oldest method, needle and syringe, insulin pens, pumps, inhalers, jet injectors, or an insulin port. The delivery method is determined by the medical need and lifestyle of the patient.
Risk of treatment. Like every medication you take, it comes with side effects. Diabetes medication helps keep your blood sugar levels from getting wacky, but they also have some side effects and can interfere with other medication you take. Type 2 diabetes medication is usually given by oral medication. If oral medication does not work, then you may need to supplement with insulin. Some of the side effects of insulin drug therapy are hypoglycemia. Another popular medication that is given is metformin. Metformin is normally the drug that they first prescribe to you. Side effects from this medication can be nausea, gas, bloating, diarrhea, and a B12 deficiency. Metformin can also cause a condition called lactic acidosis.
Compared to the average American, diabetics face over twice the annual medical expenses. This translates to approximately $9,000 a year in medications and supplies. In 2017 alone, diabetes cost Texans approximately $19 billion overall. The suspected total impact to the American economy is north of $300 billion annually.
Dietary restrictions of disease. With having type 2 diabetes comes with a lot of restrictions in the types of foods you can consume. Some of them being high-fat meats, full-fat dairy, sweets, sugar-sweetened beverages, sweeteners, processed foods, and trans fats. If you're mindful of those restrictions, it can help you keep the disease under control.
If you have diabetes, check your feet every day for any signs of blisters, cuts, scrapes, bruises, or any sign of redness. This is one of the biggest issues many diabetics get admitted into the hospital for. Many diabetics develop non-healing ulcers or wounds that can rapidly lead to toe amputations and eventually a below-the-knee amputation. If you have diabetes
type 2 is unlike many other health conditions. Diabetes is managed by you
bruises,
and
or
can be
any
prevented
sign of
by
redness.
you.
This is one
A
of
few
the biggest
preventative
issues many
strategies are
diabetics get
minimizing your
admitted
food
into the hospital
portions,
for.
choosing
Many
foods with less
diabetics
fat,
develop
and
non-healing
having a
ulcers
nutrient-dense
or
diet.
wounds that can rapidly
Limit
lead to
your
toe amputations and
monosaccharides.
eventually a below-the-knee
Exercise about
amputation.
30 minutes a day. Lose weight
If
and
you
keep
have
it
diabetes,
off.
check your feet
You could
every
prevent
day for
diabetes
any
alone
signs
just
of
by losing weight.
blisters, cuts,
Also,
scrapes,
stop
bruises,
smoking.
or
As we
any
know,
sign
smoking
of redness.
causes many
This is one
chronic
of the biggest
diseases,
issues
and
many
diabetes
diabetics
is one
get
of them.
admitted into the
Smoking
hospital
can
for.
cause insulin
Many
resistance,
diabetics
can
develop
raise your
non-healing
triglycerides, and
ulcers or
increase
wounds
inflammation,
that can
making it
rapidly
harder for
lead
your
to
body
toe
to use
amputations
insulin
and
right away.
eventually a below-the-knee amputation.